The whole page. I got it.
The largest insurer in this state, and one of the nation's biggest insurers, had a $420 million profit last year. And that the chairman and CEO of WellPoint last year made $9 million. So where do you think these soaring premium costs are going?
CEO!
And they're paying for a lot of lobbyists and a lot of people in Congress in Ohio who want to rewrite the rules so there's more profit in the insurance industry, and your costs go up, even if you are insured in this state. They reject applicants. Did you know that the Department of Insurance in the state of Ohio says that 35% of all the complaints they get are a rejection of coverage from people already insured? Roll up these huge profits. So the question we're asking today, all of us, is which side are you on? Are you going to be on the side of quality, affordable health care and solving this problem in Ohio and in this nation once and for all after 16 years of those folks in that CEO payouts while we pay the cost on our own backs? Well, there's other folks here who are going to tell you their stories. But let me tell you this. The next president of the United States and the next Congress is going to have to deal with this problem. And they have to decide whose side they're on.
We will mobilize from the bottom up to hold our elected officials accountable. We will ask them, which side are you on? 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 Which side are you on?
So Sister Diane has to pay a lot of money just to visit the doctor. She's an epileptic, and she's afraid that the next seizure is going to end up in her hospital and she'll be poor for the rest of her life. Diane's message is very clear, that something's got to change in this country, but we're dying while we're waiting for a solution. Let's get healthcare changed now.
Get it done now. Nearly 3 years ago, I got that call that nobody wants to get in the middle of the night. On the way home after visiting with me and my family, my parents were struck head-on by a car crossing the interstate median. My mother died on the scene, and my father was rushed to the hospital with life-threatening injuries. It was unspeakably horrible. He spent 5 weeks in the surgical intensive care unit and went on to spend another 6 months different healthcare institutions. He was only 55 and had been running his own business, hanging garage doors and installing garage door openers. We knew that work was never going to happen again for him. But we wanted to give him a chance to at least be able to walk around his own house again. But 2.5 months later, after the accident, we began fighting with the insurance company and their assessment of his opportunities for capacity for recovery. Beginning in mid-January, it was a weekly battle with social workers to get him another week's stay. In March, it took a call from his trauma surgeon to his friend at the insurance company who'd been denying him his request to go to an inpatient rehab facility. They finally let him go. He was making progress. But 7 months after that terrible accident, my father had to go home. The insurance company was tired of paying for him. Despite the fact that they set the benchmarks, they said what he had to do, they said, we're done. They sent him home to rot. They told us it was time to go home and live the rest of his life. He required 24-hour care and assistance, but they weren't paying for that. We had to take care of that. Meanwhile, he's paying COBRA because my mother was the insurance carrier for our family. I grew up in a small farming community where everyone knew us. Fortunately, they pulled together and helped care for my father. It was called the fundraiser, so that he could go
uninsured, the people with resources and the people without. But we all know that the healthcare system is broken. We need to fix it now. Take control over healthcare from the insurance industry.
Insurance companies and protect consumers so that we can get the health care we need without going broke. Right. While AHIP launches its campaign now, we have one clear idea in common with them. Health care is broken and we must fix it now.
You guys did pretty well. Went along with the program, no problems, no hassles.